This is the David Goodman Reality and Truth Show. My name is Finita Lambert, and I want to thank you so much for joining me today. Today is a really special day for me because it is my birthday today. I am officially a senior, and I was kind of tripping over that because I'm going to be able to get senior discounts and things like that. And I don't know. I guess it's just time is just going so fast. Just to hear myself say that I'm a senior is just kind of strange. So what I did, I tried to dress like a junior. So how did I do? I hope I did okay because I'm fighting old age every step of the way. I appreciate every birthday that I get, but I'm just not settling into old age yet. And you know what? No matter how old you get, every time it's your birthday, I think everybody feels like a little kid inside because that's how I feel today. Like I'm running around telling everybody it's my birthday so they can say happy birthday and things like that. So it's just kind of weird. But anyway, I wanted to share that with you. And I also want to share with you guys that I'm going to be talking about Medicare and some of the things that keep you up at night. But before I get into all of that, I would just like to tell you a little bit about why I give out information and why I do the job that I'm doing. So we'll start there. I started this job as a licensed independent insurance agent. And it's because I just needed a job, just like everybody else, to pay my bills and this, that, and the other. But a couple years into this profession, this business, I developed a passion for helping people. And I knew I wanted to help people, but I just didn't know how to do that. And so I started joining organizations, you know, the National Council of Negro Women, the Minority Business Association. They're all nonprofit organizations to just help people, like the National Council of Negro Women, they advocate for young African American girls. And the Minority Business Association help small businesses in so many different ways. And so I'm looking for ways to help people. And at the same time, it was right in front of me. I was already helping people and didn't realize what a value I was to them because I do Medicare, help people pick out Medicare plans and life insurance and things like that to protect themselves, their family, and their nest egg. So when I do home visits, you know, I'll drive anywhere in Connecticut, sit down, and give you a free confidential needs analysis, or you can come to one of my offices in Farmington or in Shelton, and I will do a confidential needs analysis on the 4 areas that will affect your life the most. And those are your health care, long-term care, life insurance, and retirement income. And so in the midst of doing my job, I was leaving homes in a better place than I found them. So for example, I would come into some homes and a lot of people did not understand, or I wouldn't say understand, they didn't have all of the information to select a plan and to take advantage of benefits. So without the information, there was no way that they could take advantage of the benefits. So I sat down with them and I ask questions, and then based on my answers to those questions, I make a recommendation. And I found that I was able to save a lot of folks money, like couples, husband and wives, and just individuals based on their grossly monthly income. Even if they had assets, they did not understand anything or didn't have any information about the Medicare savings program and how that program could help them pay their Part B premium. So because they had assets, they just assumed because they had, you know, a 401k and owned their house and, you know, money and things like that, that they did not qualify for any any of the other Medicare savings program. They didn't know anything about it, and they had never applied for it. So this one couple, I came into their home and I sat down and we went through everything. And I was able to put them on the Medicare savings program. So they each saved, this year it's $170 a month. I'm not sure what year it was. I think it was $104, and it goes up every year. And I've been doing this for 8 years, so I'm not sure. But I saved both the husband and the wife the Part B premium, so they were able to put that money back into their homes for, groceries or utilities or whatever. So then I developed the passion. I said, wow, I really helped them. I really put, a couple hundred, $200-$300 every single month back into this home, which came out to, I don't know, 10,000 a year or 2,000 a year. I mean, 2,400 a year. Let's just say it was $100 a month, $1,200 each. That's $2,400 back into this home. And with that extra money, then, they were able to maybe purchase life insurance or something that, they weren't able to do before, or just apply it toward their bills. And so that made me feel really, really good. And you have a passion for something when you do something like that, and this couple is saving money, but I'm the one that's feeling good about it. So you're in, I was in my moment. That was my moment. I felt so good. And so as I started doing things like that, it just, I developed a deeper passion, and not just with Medicare, but with other areas that I was able to help people save money or select a better plan or make them understand, their policy better and things like that. It just, so that's why I do a radio show called the Medicare and Retirement Planning Show. I pay for my own service, because you have to pay for the radio if you're going to be on it, to give out free information so that people in the community can take advantage of it. And that radio station is on demand. It's on smart speaker. There's a number you could call to listen to it. Just on, even if you have a flip phone, if you have one of those government phones, or you could tune in live in your office and just listen to the information, because there's a lot of confusion out there about Medicare, and there's a lot of information out there about Medicare that maybe a small portion of it apply to you and most of it don't. So the best thing that I can do is customize a plan for the person that I'm sitting in front of, because the information you get, especially from the commercials on TV, some of that information is true for some people, but it is not a cookie cutter. It's not going to help everybody out there. And so I find that to be somewhat misleading, but there's always a small print and disclaimers to help them protect themselves for saying the things that they do. Like, everyone will not get money back into their Social Security as they say it. And what they mean by that is that state, and it's different in every single state, Medicare laws are different in every single state, that state will pay your Part B premium. That's basically what that means. So I just want to give you a basic understanding of Medicare. And before I get into that, I had a client that came to me the other day. He goes, I'm getting all this paperwork. I'm turning 65. He's going to be 65 in September. I have no idea what to do. And they sent me this book, this 200-page book that says Medicare and You, and I just don't know what to do. So I'm going to drop it off to you. He's a good friend of mine. So he drops me off all of the mail and the letters he's been receiving, his Medicare and You book, and all of his information. And I took that information, I called him up and, asked him the questions that are on the confidential needs analysis. And I was able to help him select a plan that would service all of his needs. His doctor was in the network, and it was a Medicare Advantage plan. And he qualified for the Medicare Savings Program. He just knew nothing. And then the funny thing I thought was he wanted to pay me for doing it. My service is 100% free. You don't pay me for anything whatsoever. I take a lot of pleasure in just sitting down with you, helping you resolve whatever issues or answer questions for whatever concerns regarding whatever type of insurance that you might have questions about, or questions that keep you up at night. So I'm going to start off with just a little basic information about Medicare. So when you get that big 2022 Medicare in you and you're turning 65, whether you're working or whether you're retired, I can help you coordinate whatever situation you're in with that book and your job. So, and your Social Security as well. And we'll get into that a little bit later. So, Medicare Part A, I'm going to go through the A, B, C, and D's of Medicare. That's as simple as I can make it. And keep in mind, it has a lot of moving parts, and I will customize it for you. So everything that I'm saying is not going to apply to every single person. So Medicare Part A, except for Medicare Part A, is your inpatient hospital insurance. In order to qualify for Medicare Part A, you have to work 10 years or 40 quarters in this country and pay your Medicare taxes, just like you pay your federal taxes, Social Security. You have to pay your Medicare. If you look on your stub, you'll see that you're paying for your Medicare taxes. So if you pay into that for 10 years or in any combination of 40 quarters, then you are entitled to Medicare Part A, which, like I said, is your inpatient hospital insurance. Now, assuming you have no co-insurance, no supplements, no Medicare Advantage, nothing else, just your Medicare Part A, and say you go into the hospital, there is an annual deductible. This year is $1,464, or I'm not looking at the book, so it could be $1,484. Don't quote me on the number, but there is an annual deductible for this year under $1,500. Okay, so if you went into the hospital once, you pay your $1,484, whatever it is, and then if you go into the hospital a second time within the same year, from January to December, then you don't have to pay that deductible. Okay, so that's basically Medicare Part A. And then the first 60 days you get for free. And then after that, there's like daily rates, which I don't have the book in front of me, so we don't need to get into all that. Just want to give you the basic information. And then there's no monthly payments for Medicare Part A as well. And then there is Medicare Part B. But let me go back to Medicare Part A for a second. If you're turning 65 and you are still working for an employer, you would have to apply for your Medicare Part A. As long as you're working for an employer and you're not collecting your Social Security, you will need to apply for Medicare Part A. It's not going to come to you automatically. If you are not working and you turn 65 and you're collecting your Social Security, then you will automatically be signed up on Medicare Part A, because the Social Security office is the office that sends out those cards. Okay, and if you're collecting your Social Security, you turn 65, it's automatic. But if you turn 65 and you're collecting Social Security, not only will you need Medicare Part A, you will also need Medicare Part B. Now, Medicare Part B is your outpatient care, meaning doctor visits, medical supplies, and things like that. Medicare Part B will pay 80% of all of your outpatient care. You are responsible then for 20% of your outpatient care. And the 80% that Part B will cover. There's a fee for that. It's not free like Medicare Part A. You don't pay into it in advance. This year, it's $170.10 per month for Medicare Part B. And then there's extenuating circumstances. So if you qualify for the Medicare Savings Program, that will be covered. But we're just going on the assumption that you don't qualify for anything yet. So we got Medicare Part A, which is your inpatient hospital. Medicare Part B is your outpatient hospital, and that covers 80%, which is covered by a monthly premium of $170.10, and then you are responsible for paying the remaining 20%. So now there's two ways that you can pay for that remaining 20% of your Medicare Part B. You can go the original Medicare amount, which is your Part B, your Part A, B, and you could pay for a supplement, which is also known as a Medigap plan, and then you would have to pay for your Part D, which is your prescriptions. That's your drug plan, okay? And you have to have a drug plan. If you don't have a drug plan, when you're eligible to sign up for Medicare, then you'll be penalized at a later date, okay? So that's one way to go. The other way to go, and so far we talked about Medicare Part A, Medicare Part B, and I skipped over C. We're talking about Medicare Part D, which is your drugs and your prescription. Now, the other way to cover the 20%, to cover that 20% gap, is called, and I'm sure you've heard these commercials, Medicare Part C. Medicare Part C is also a Medicare Advantage plan. So, and I know it's very confusing because last year, all I heard the commercials say was Medicare Advantage. And now this year, they're saying Medicare Part C. And so don't think it's two separate things. It is all the same thing. And this is how confusing it could be if you're just listening to someone like myself on TV and not sitting right in front of someone that you can ask all these questions. So yes, I'm on TV, and yes, I'm giving you this information, but I will drive to your home, sit at your kitchen table, and you could ask me questions. And then if a question comes up later, I will leave you with my business card that has my cell phone number on it so that you can call me if you have another question or if something should change. So getting back to Medicare Part C, that is the second way, second road, second way, whatever you want to call it, that you can cover that 20% of your Medicare Part, that Medicare Part B does not cover, that you are responsible for. And that's called, once again, Part C or Medicare Advantage plan. It's all the same. And so Part C is a little bit different. Part C, your doctor would have to be in a network. So there are some restrictions. So your provider has to be in a network, in which we will check for you, find out what your doctor's name is. If he's in a network, then we move on to the next step. You have to live in the service area. That's why in the commercials they ask for your zip code. Then they have fixed copays. They have fixed copays, and then they have a maximum out-of-pocket cost. This is something they don't talk about on TV, and this is something that I feel is really important. You want to get all the information. You want to get the good, the bad, and the ugly. And the maximum out-of-pocket, in my opinion, is not the ugly, but in the case of an emergency where, multiple things could go wrong in a single year, you want to know what is the maximum amount that you're going to spend out of pocket if you have a Medicare Part C plan. Now, that amount varies. Some of them, the average amount that you could spend annually out of pocket on a Medicare Part C plan is $6,700. Now, that is not a deductible. That is just your cap. And I hope you guys remember way back when we didn't have a cap before we had Access Health, excuse me. People were mortgaging their homes to pay for their care. They were cashing in their 401ks because they couldn't afford to pay for surgeries. So I think during the 2008-2016 administration implemented a healthcare plan called Access Health, Affordable Health Care Act, or Obamacare, or whatever you want to call it. And that way they mandated that there be a cap on the Medicare plans. Okay, this was in addition to Medicare. So the most you could spend on average, some of them, I've seen some this year that went up to $7,500. But let's just say it is good to know that if you decide to sign up on a Part C plan, that the maximum amount of money that you can spend out of your pocket in a given year could be $6,700. Doesn't necessarily mean it will be $6,700. If you are on the Medicare Savings Program, you won't spend a penny out of pocket. If you are not on the Medicare Savings Program, then you will have to pay, let's say, for example, $20 for your primary care doctor every time you go, $45 for a specialist when you go. If you take an ambulance, that's going to be $300. You don't pay the full bill. You don't pay the first $6,700. The $6,700 that you will pay is the worst case scenario. And I'm talking if you needed chemo, if you went into the hospital 5, 6, 7 times and you stayed in there for, 3, 4 weeks at a time, and just worst case scenarios. And that includes all of your Medicare bills, all of your co-pays, and all of your deductibles, everything combined. Once that number hits $6,700 and your worst case scenario, then you don't pay anything else for the rest of the year. Now, and that is to cover the 20% that Part B doesn't cover. Let's take a step back, and let's say that you just decided to roll with your red, white, and blue card, your Medicare Part A, your Medicare Part B, which is only 80%, and you did not cover that 20% gap, and you went into the hospital and all these things went wrong, then you will be responsible for paying for 20% of whatever that hospital bill is. So if that hospital bill comes out to be $100,000 and you don't have a plan or a supplement to cover the 20% that Part B doesn't cover, then you're gonna, let's say it's $100,000, then you're gonna have to pay $20,000. That's 20% of the $100,000. So it's very important to understand that even when you do turn 65, and even when you do get your red, white, and blue card, your Medicare Part A and your Medicare Part B, that Part B only covers 80%, and you need to protect yourself with a Medicare Advantage Part C plan or a Medicare supplement. So the difference between the Medicare supplement and the Medicare Part B, what are they? The Medicare supplement is you will pay for, I don't know, let's call it an F plan, okay? And maybe that F plan would pay 50% of all of your bills. So you will be paying for your Medicare Part B, okay? And you would not choose a supplement if you're on the Medicare Savings Program. So that's why, these plans need to be customized for the person that I'm sitting in front of, because I would not go through all of this if I was sitting in front of one person, because I would ask the questions, I would know their situation, and I would make the appropriate recommendation. But since I'm on TV talking about it, I want you to understand that there are 2 ways that you could go. And if you took the traditional Medicare Advantage, the traditional Medicare plan through original Medicare and went the supplement route, then you would not be on the Medicare Savings Program, because I would not recommend that you pay for something that you could get for free. It just, it just doesn't make sense. So with the supplement plan, that does not have any restrictions, okay? The supplement plan, you can go to any doctor in the country that accepts Medicare. There are no restrictions whatsoever. and they will accept your plan. Okay, with the Medicare supplement, you may not get additional benefits that you're going to get with the Medicare Advantage Part C plan. Some of the benefits, some of the extra benefits that you will get beyond Part A and beyond Part B with a Medicare Advantage plan are, is dental. You'll get dental. Some of them have vision, hearing allowances. You get a free gym membership. There's over-the-counter benefits and over-the-counter cards where you can get, I don't know, up to $50 a quarter or $40 a month. Each one of these plans are different, and all in every single county in Connecticut has a Medicare Advantage plan. So, and sometimes it doesn't depend on how much money you have. It could depend on your health. Why pay for something every month if you only get physicals and you're completely healthy? So what I am saying is that you need to, the annual enrollment period is coming up really fast. It starts October 15th and it runs through December 7th. If you are on a Medicare plan of any type, whether it's a supplement or a Medicare Advantage Part C plan, now is the time to take a look and call your agent. And if you don't have one, you can call me and just review everything that you have in your plan and ask questions. Compare the annual changes. There are changes every single year in these plans. Sometimes the changes are for the better, but once in a while you may lose something, and you might not know about it if you are not informed or if you don't read that full book. So that is my show today. I urge you to get the information so that you can make the right decision to protect yourself with your health care during the Medicare annual enrollment period. I want to thank you very much for spending this time with me, and I hope to hear from you soon if you have any questions. This is the David Goodman Reality and Truth Show, and we're on your side.